Hello everyone, this is Suyesh here, and now in this video we'll be continuing in the section of our pharmacokinetics, in which we'll be discussing the third video, that is our metabolism. Okay, so in the previous videos we have discussed the absorption of drug first of all in the section of our ADME, which we are saying from the first video. In the section of pharmacokinetics, the absorption, D is for distribution, which we have seen. Now drug has absorbed. Now the drug has been distributed to different tissues and organs. Okay, and now the drug has to be metabolized for the excretion or elimination from the body. Okay, so that is the process is called as metabolism of drug. So this is the third video in the section of metabolism. Okay, so in before continuing in the section of metabolism, as we know that metabolism is just a part of excretion. Okay, so just consider elimination. So elimination is a process or excretion of drug. Okay, irreversible excretion of drug, in which we actually include elimination. Okay, so in elimination we actually include the metabolism and your excretion. Okay, so elimination is different from excretion, so don't mix these two words together. Okay, in elimination we include metabolism and excretion. Clear? So elimination is fully a irreversible process, and metabolism is actually the chemical alteration of the drug in the living organism. Okay, so that we are going to see, and excretion is the excretion of drug, that is the excretion of drug out of the body. Okay, the drug which you have taken, now that will be excreted out of the body through your kidney. Okay, or through your hepatic that is your through bile also. Okay, through feces. So that is a process called as excretion. So in elimination we have two processes. So first is we have to see the metabolism in this video. So in metabolism, the another name of metabolism we say is biotransformation. Okay, why bio? So bio meaning is actually living organism. So this transformation of drug is that is a transformation of drug in one form to the other form. So it is happening in a living organism. That is why the word bio is used, and the transformation for the drug or for the metabolism, that is a chemical alteration of drug in the living organism. So this is a definition for metabolism or biotransformation. So chemical alteration of drug in the living organism that I have written. Clear? So now what is the aim of the metabolism? Why we have to do the metabolism of the drug? Actually the drug which you have taken, that is lipid soluble, as we are discussing from the first video, this point, this concept, that is the lipid solubility is must for the drug absorption and distribution, for the better distribution. So lipid solubility is now the lipid solubility is also important point, but what we have to do is to make the drug water soluble. Okay, so the drug which was water soluble was not able to absorb, okay, due to the inability of the crossing the lipid bilayer membrane. So that is why we used to give the drug which are lipid soluble. Okay, so now here we have to reverse. Actually now we have to convert the drug which we have given lipid soluble drugs into water soluble drugs. Okay, so the aim of metabolism is to make the drug water soluble, that is called as polar or ionized form. Okay, and why we have to do this? Because as the drug is metabolized from the liver or hepatic metabolism or biliary metabolism, okay, or through the kidney. So when the drug reaches your glomerular apparatus or PCT, now what happens is that due to the lipid that is lipid absorption, okay, reabsorption. So due to high lipid solubility of these layers in the kidney, now the drug which are lipid soluble will be again reabsorbed from the DCT. Okay, after going through the glomerular apparatus, then PCT. Now from the DCT they will be again reabsorbed. So there is, you will not give the result. Now again the drug will be absorbed in the body. So now we have to make the drug water soluble for the excretion. As we know that kidney excrete the water soluble drugs, so the water soluble drug will be excreted out. Clear? So this is the concept here. So the meaning is that, so they are not reabsorbed in renal tubules. Okay, so because of the lipid solubility, the drug will be again reabsorbed through the lipid bilayer membrane. If the drug becomes the water soluble, then it will not be reabsorbed and it will be excreted out through the collecting duct and through the urine. Okay, so that is the concept. Clear? And now where actually this metabolism occurs? Now where actually the metabolism occurs? The main site of the metabolism is the liver. Clear? And other sites can be also there, like kidney. Some metabolism occurs in kidney also, lungs also. Okay, GI tracts also, skin also. Okay, and biliary metabolism is also there, and sometimes in placenta also. Okay, so these are the other site, but the main site we have is the liver. Clear? Now the metabolism can lead to further three conditions. Okay, now drug can be with the drug there can be three conditions with the drug can happen. Okay, now we have to see that. Now the drug which we have given, if the drug is active drug, okay, so after metabolism the product which is formed is called as metabolite. Okay, so after metabolism, if the drug was active when you gave the drug to the patient, now the drug becomes inactive after metabolism. So this happens with some of the drugs. Like example you have here is phenytoin. Okay, so phenytoin becomes para hydroxyphenytoin after the metabolism. Okay, so drug was active when you gave the drug, now after metabolism drug become inactive. Okay, so this is the first condition that can occur after the metabolism. Now if the drug was active, okay, now its metabolite was also active. The meaning is that after metabolism the metabolite of the drug, the pieces of the drug which was formed was also active. Okay, so like in the case of diazepam. Okay, so diazepam, these are hypnotic drugs, okay, seizure drugs, anti-epileptic drugs. So diazepam actually is also an active metabolite, means active drug when you give diazepam to the patient. Okay, and now the oxazepam, it's active metabolite, it's also a active drug. Okay, it will also works at diazepam. So there can be drug toxicity. Okay, if you increase the dose of diazepam, so there can be drug toxicity to the patient. So you have to adjust the doses for the, if you are giving a patient diazepam, because its active metabolite is also performing its action. Because okay, so like in the case of digitoxin we also have. Okay, so this is actually an diuretics. Okay, digoxin, and now it converts into digoxin. Okay, it is not diuretic, sorry, it is cardiac glycosides. Okay, it is used in heart failure. So digitoxin is a drug which can convert into digoxin. So both are actually active drugs. Okay, both are actually active drugs. So there can be the increase in the plasma concentration of this drug, and there can be drug toxicity because of that. Clear? And like codeine also, okay, they are highly analgesic drugs. Okay, painkiller, morphine and codeine. So codeine actually is also active drug, and morphine is also an active drug. Now the third conditions we have is the inactive drug. So if the drug was inactive when you gave the drug to the patient, now after metabolism its metabolite what was active. So in this section we have, and this inactive drug is actually called as prodrug. Okay, so we have some drugs which are actually inactive when they go inside the, when you gave the patient through any of the route, they are actually inactive. Okay, so this inactive word is actually also called as prodrugs. Clear? So after metabolism they become active and perform its action. Clear? So in this we have the perfect example is levodopa. Okay, so here the main concept I want to tell you is that what happens in this case is that, just consider, I'm just giving you a representation. So levodopa, just consider this levodopa. So what happens is in the brain is that you have a blood brain barrier and you have dopamine. Okay, so this is actually, dopamine is actually given in patients with anti-Parkinsonism drug who are suffering from Parkinsonism. Okay, Parkinson's disease. Clear? So dopamine can't cross the blood brain barrier. Clear? But levodopa can cross the blood brain barrier. Okay, so when the levodopa crosses the blood brain barrier, inside the brain levodopa actually converts into dopamine. Okay, by enzyme called as dopa decarboxylase. Okay, so it's inactive form. Okay, so levodopa was inactive, but its active form was the drug which we want. Okay, which we want for the action of the drug. Okay, so that is the concept here, that is levodopa is an active drug but dopamine is an active metabolite. Okay, so we can't give dopamine directly to a Parkinsonism patient. Clear? So like this we have prednisone and prednisolone. Okay, so prednisone is a prodrug and prednisolone is an active metabolite. Okay, so this is a glucocorticoid steroidal drug, enalapril and enalaprilat. Okay, so these are actually ACE inhibitors. Okay, anti-anginal, you can give an anti-anginal drugs. Okay, so this was actually the three concepts behind the metabolism, how the drug can behave. Okay, so now the drug, we know that now drug the metabolism has started. Now drug has to go two pathways. Okay, there will be two pathways for the drug metabolism. So there are two phases actually, you can say. So first phase is actually called as non-synthetic reaction or functionalization of reaction, that is addition of functional group on the drug. Okay, so aim is to add the functional group on the drug as I have written. Okay, and phase 2 reaction is also called as synthetic reaction and conjugation reaction. Clear? So it is the main aim is to make the drug water soluble. Clear? So it will add the functional group on the drug, and this phase 2 will make the drug water soluble. Clear? So these are the two pathways which we will be seeing how the drug is metabolized. Clear? So these are the other names, you should know these names because the question can come from these names also. Clear? Now the phases we will discuss in the next video in detail, phase 1 and phase 2. We will see some brief points on the phase 1, and then we will see some basic concepts on phase 1 and phase 2 with respect to drugs. Okay, now phase 1. So phase 1 actually converts your lipophilic drugs into more polar molecules. As I have said you, lipid soluble to water soluble is our aim in the section of metabolism. So the conversion of lipid soluble drugs into more polar is meaning hydrophilic, okay, or you can say water soluble, by the introduction or unmasking a polar functional group like hydroxyl and amine. Okay, so we phase 1 reaction we do by this, and there can be some types of reaction like oxidation, okay, reduction, hydrolysis, deamination, and cyclization, and also decyclization. Okay, so these we will be discussing these reactions in detail. Okay, this is a basic overview of phase 1. We will be discussing in next video in detail about phase 1 and phase 2 reactions and enzymes which will be acting in the metabolism, microsomal and non-microsomal enzymes. Now I have to tell you one concept here, what can happen with the drug, okay, in the phase 1 and phase 2 reaction. So just consider this is your drug, okay, and this is your phase 1 reaction. Clear? And just consider this is your phase 2, and after phase 2 there will be excretion. Clear? So this is the main pathway of elimination, okay, in which we will be having a metabolism and then excretion, and combining that we say it as elimination of drug. Now the drug can go through phase 2 metabolism also, like this it will go phase 2, there will be oxidation, hydrolysis of drug, okay, then after that the drug will go through phase 2 reaction, okay, that is the what we say conjugation reaction, okay, addition of some glucuronide group, acetic acid group, amino acid group. So these are the groups we will be seeing in a later video. This will now attach and make the drug water soluble, because these groups are actually more polar and they make the drug water soluble, okay, and then the drug will be excreted out. This will be the first pathway, okay. Drug can go by this way also, and sub drug can go directly from phase 2 reaction, okay, phase 2 reaction, which are little bit water soluble and little bit lipid soluble, so they can directly go through the phase 2 reaction and then excreted out. So this can be the second condition, this was the first, okay, clear. And sometimes the drug passes the phase 2 reaction and excreted out, okay, sometimes this can also happen. Clear? And if the drug is not the meaning is that if the drug is not not become polar in the phase 1 reaction, then it has to go undergo again, okay, again it has go to, undergo phase 2 reaction for the more water solubility. So that is why the first reaction was phase 1 reaction, some drug is still lipid soluble, that is why not excreted. So now the drug will go through the phase 2 metabolism, okay, phase 2 metabolism and then excreted out, and the drug can directly go through the phase 2 metabolism, okay, that can be the drug case. And the third case can be drug can be directly excreted. So the drugs which are actually the administrated drug is direct the drug which you have administered, it is already water soluble, so we don't have the need to pass through the phase 1 or phase 2 reaction, and that drug can directly be eliminated or excreted from the body. Like we know that streptomycin is there, aminoglycosides, antibiotics, some antibiotics are water soluble, okay, PCM also. So these drugs directly they comes inside the body, and directly they do not go any type of phase 1 phase 2 section, and they are directly excreted out. And some drug can go phase 1 and then phase 2, and some can go phase 2 directly, okay. So these are the three ways the drug can be excreted out, okay. So this was the first video on metabolism. Next video will be discussing in detail about phase 1 and phase 2 reaction, the enzyme which will be acting there. Clear? So do like, share and subscribe the channel.